Hello everyone, and welcome back to the channel. I'm Dr. Richard Miller. If you're watching this right now, there's a pretty good chance you or someone you love just walked out of a doctor's office or pharmacy with a prescription for amlodipine in your hand. And I know exactly what that moment feels like. You look down at that little label, your eyes scan that intimidating list of possible side effects, and suddenly your stomach drops. Peripheral edema, palpitations, gingival hyperplasia, flushing, dizziness. It can feel like you're trading one problem for a whole bunch of new ones. I want you to know something right from the start. I see this every single day in my clinic, and my heart goes out to you. You've worked hard your whole life. You've raised families, built careers, maybe served your country or taken care of your own parents. Now you're being asked to start a new chapter focused on your heart health. And the last thing you want is to feel like your body is betraying you or that you're losing control. So today we're going to sit down together, just you and me, and talk about this medication like we would if you were in my office with a cup of tea. We're going to cut through all the noise, separate the real concerns from the scary legal language, and give you the confidence to work with your doctor instead of worrying in silence. I'm a 40-year old German-American doctor practicing here in the United States, and I've spent years taking care of thousands of patients just like you, many of them in their 60s, 70s, and 80s. What I've learned is that knowledge isn't just power, it's peace of mind. And peace of mind is something we all deserve as we get older. Let me start with a story that might sound familiar. Last month, Margaret, a vibrant 72-year-old grandmother of 5, came into my office almost in tears. She told me, "Dr. Miller, I've always been the one who takes care of everyone else. Now, my ankles are so swollen I can't even wear my regular shoes, and I'm terrified I'm going to fall when I get up too fast. I feel like I'm becoming a burden." I took her hand and said, "Margaret, this isn't you failing. This is chemistry, and chemistry we can work with." That's what I want to offer you today. Not just information, but a sense of partnership with your own body again. Because these symptoms aren't mysterious punishments, they're signals. And once you understand the signals, you can respond with wisdom instead of fear. So let's begin by talking about that long, terrifying list on the pharmacy bottle. Here's the truth. That list isn't really written for you. It's a legal document. Pharmaceutical companies are required to report every single thing any person in any clinical trial ever mentioned while taking the medication, even if it had nothing to do with the drug. Someone got a headache during allergy season, it goes on the list. Someone caught a cold, on the list. Someone had a bad day and felt tired, you get the idea. In my years of practice, I've learned to look at the actual science of how the medication works inside your body. That's how we tell the difference between something that's truly connected to the drug and something that's just coincidence. And when we understand the why behind the side effects that actually happen, we stop feeling like victims and start feeling like informed partners in our own care. Let's talk about how amlodipine actually works, because once you see the elegance of it, you might even feel a little amazed. Think of your blood vessels as a beautifully designed plumbing system that's been working for you for decades. When blood pressure stays high for too long, it's like turning up the water pressure in old pipes. Eventually, something's going to strain or leak. Amlodipine is a calcium channel blocker. It gently prevents calcium from rushing into the smooth muscle cells that line your arteries. When that calcium is blocked, the muscles relax. The arteries open up. Blood flows more easily. Your heart doesn't have to work so hard. It's actually a very graceful solution, one that's helped millions of people prevent strokes and heart attacks. But here's where the story gets interesting and where we start seeing those side effects that bring so many of you into my office. When those arteries relax, especially the ones farther away from your heart, it creates a natural pressure shift in your circulatory system. The arteries dilate more than the veins. It's a little like watering your garden with a hose that has the nozzle taken off. More water flows through, but if the drainage isn't quite keeping up, things can pool. That brings us to the side effect I hear about more than any other, peripheral edema, or swelling in the legs, ankles, and sometimes feet. This is especially common in older adults, and there's a very good physiological reason for it. Gravity has been pulling fluid downward in your body for many decades. When the arteries open up, more fluid is pushed out through the tiny capillaries into the surrounding tissue, particularly in the lower parts of your body where gravity wins the battle by the end of the day. I want to be very clear about what this swelling looks like and what it doesn't mean. It's usually both legs, not just one. It tends to be worse in the evening and better in the morning after you've been lying down. You might notice your socks leaving deep marks in your skin. Your shoes might feel tighter by 3 o'clock than they did at 9 in the morning. Some of my patients tell me they can press a finger into their ankle and the dent stays there for several minutes. Now listen carefully. This is not heart failure. It is not an allergic reaction. It is not your body rejecting the medication. It is simply a plumbing imbalance that we know how to manage beautifully, and manage it we will. So what do we actually do about it? First, please hear me when I say this. Do not suddenly stop your amlodipine. That can cause a dangerous rebound in your blood pressure that puts you at higher risk for the very things we're trying to prevent. Instead, we work together as a team. Many times the swelling is mild and we can handle it with simple lifestyle adjustments that actually feel good. Elevating your legs for 20 minutes in the evening while you watch your favorite show. Wearing compression socks that many of my patients say feel surprisingly comforting. Reducing salt in your diet, not in a punishing way, but in a mindful, flavorful way. I often tell patients to experiment with herbs and spices they might not have tried before. My German-American grandmother taught me that flavor doesn't have to mean salt, and that lesson serves so many of my patients well. If the swelling is more significant, we have excellent medical options. Sometimes adding a low-dose ACE inhibitor or ARB medication creates a beautiful balance that actually reduces the edema while giving even better blood pressure control. Other times we simply lower the dose. Amlodipine effects are very dose-dependent. Moving from 10 milligrams to 5 milligrams often makes the swelling disappear while still protecting your heart beautifully. And if none of that works, there are many other blood pressure medications that might suit your body better. There is no medal for toughing it out with a medicine that doesn't agree with you. I had a patient named Robert, a 8-year-old retired engineer who came to me after 3 months on 10 milligrams. His legs were so swollen, he had stopped his evening walks with his wife, something they had done together for 30 years. We dropped him to 5 milligrams and added a very small dose of an ARB. Within 2 weeks, his ankles were back to normal, his blood pressure was excellent, and he and his wife sent me a photo of them walking on the beach at sunset. That's the kind of victory I want for you. Let's talk about another common experience that can catch people off guard. Flushing and that feeling of warmth in your face, neck, or chest. It can feel a bit like a hot flash, even for men. This happens because the dilated blood vessels bring more warm blood closer to the surface of your skin. It's usually most noticeable in the first few weeks as your body adjusts. For most people, it gradually fades as your system gets used to the new normal. One of my patients, Linda, a 75-year-old who loves her book club, told me the flushing made her feel self-conscious during meetings. We talked about it openly. She started taking her medication at night instead of in the morning, and the symptoms became much less noticeable during her daytime activities. Simple adjustments like this can make a world of difference. The key is telling your doctor what you're experiencing instead of suffering in silence. Now let's talk about something that genuinely keeps me up at night when it comes to my older patients. Dizziness and lightheadedness, particularly when changing positions. This is what we call orthostatic hypotension. Your blood pressure medication is doing its job, sometimes a little too enthusiastically, and when you stand up quickly, your blood pressure can drop temporarily before your body catches up. In a younger person, this might just feel annoying. In someone over 65, it can lead to falls. And falls are something we work very hard to prevent because they can change everything in a single moment. Here's what I tell every single patient on this medication, and I'm telling you now with all the care in my heart. Stand up in stages. When you get out of bed in the morning, sit on the edge for 30 seconds. Then stand up slowly. Pause again. Let your blood vessels adjust to the new reality. Many of my patients have found that keeping a glass of water on their nightstand and staying well hydrated makes a noticeable difference. Dehydration makes everything worse. I also strongly encourage my patients to get a home blood pressure monitor. Not the cheapest one, but a good, validated upper arm cuff. Check your pressure at the same times each day, sitting comfortably with your feet on the floor, and keep a little notebook or use an app. Bring those numbers to your appointments. This data helps us fine-tune your treatment so you get protection without sacrificing your stability. There's another side effect that doesn't get nearly enough attention, and that's changes in your gums. We call it gingival hyperplasia. It's not extremely common, but it does happen. You might notice your gums looking puffier or even growing over your teeth a bit more than usual. This is why I always remind my patients to keep up with excellent dental care and to mention to their dentist that they're taking Amlodipine. Good brushing, flossing, and regular cleanings can prevent most problems here. It's just another example of how all the systems in your body are connected. Something I learned from my own German-American upbringing where discipline, steadiness, and balance were always emphasized. As we get older, our bodies do change in ways that affect how we process medications. Our livers and kidneys don't clear drugs quite as efficiently as they did when we were 40. This doesn't mean amlodipine is dangerous for older adults. It simply means we start lower and go slower. I often tell my patients it's like driving a beautiful classic car. You don't floor the gas pedal when you first get behind the wheel of a 1965 Mustang. You ease into it, listen to the engine, and adjust accordingly. Your body deserves that same respect and attention. I want to take a few minutes to talk about something I see far too often in my practice, and that's the prescribing cascade. This is when one medication causes a side effect, and instead of adjusting the original medication, we add another drug to treat that side effect. Then that second drug causes its own side effect, and suddenly you're on 4 or 5 medications that all started with one. I had a patient named George who came to me on amlodipine, then a diuretic for the swelling, then another medication for the dizziness the diuretic caused, and finally something for his electrolytes because the diuretic affected those. 4 medications instead of one thoughtful adjustment. When we lowered his amlodipine dose and switched to a different combination, he was able to get off 2 of those drugs entirely. His energy came back, his mind felt clearer. He told me he felt like himself again for the first time in 2 years. This is why I'm so passionate about teaching you how to advocate for yourself. You know your body better than anyone. You know when something doesn't feel right. Write it down. Bring specific examples to your appointments. Ask questions like, could this swelling be related to the dose? Would a different combination work better for me? Are there lifestyle changes we haven't explored yet? These are smart, respectful questions that good doctors welcome. Let's talk about some of the positive things that happen when your blood pressure is well controlled. I want you to picture yourself 5 or 10 years from now. Imagine being able to play with your grandchildren without worrying about your heart. Imagine traveling to see family or finally taking that trip you've been dreaming about. These aren't just hopes. For many of my patients, they become realities because they stayed consistent with their heart health plan. I often share with my patients the story of Mr. Schneider, a 9-year-old German-American gentleman who reminded me so much of my own grandfather. When he first started amlodipine, he had significant ankle swelling. We worked together over several months, adjusting doses, adding a complementary medication, focusing on anti-inflammatory foods he already loved from his cultural background. 2 years later, he was hiking in the mountains with his son, something he thought he'd never do again. His eyes sparkled when he told me the story. That sparkle is what I want for every one of you. There are also wonderful lifestyle practices that can work alongside your medication to reduce the amount you need and minimize side effects. Many of my patients have embraced what I call gentle strength approaches. Walking in nature, perhaps with a friend or spouse, gentle yoga or Tai Chi that improves balance and reduces fall risk while lowering stress. Eating in a way that celebrates real food. Plenty of colorful vegetables, omega-3 rich fish, nuts, and yes, even dark chocolate in moderation. These aren't restrictions. They're additions that bring joy back to eating. Stress reduction is another area where older adults often see tremendous benefits, whether it's meditation, prayer, listening to music that moves you, or simply sitting quietly with a cup of tea. Finding moments of calm helps your blood vessels stay more relaxed. I've seen patients lower their average blood pressure by 10 to 15 points just by addressing chronic stress. I also want to speak directly to those of you who might be caring for a spouse or parent on this medication. Your role is so important. Encourage them to speak up about their symptoms. Help them track their blood pressure. Celebrate the small victories together. One couple I work with turned their daily blood pressure check into a little ritual. They check it together, write it down, and then spend 10 minutes just talking about their day. What started as a medical task became a moment of connection. I love that. Let's talk for a moment about when you should reach out for help immediately. While most side effects we've discussed are manageable, there are certain symptoms that deserve prompt attention. If you notice swelling in only one leg, particularly if it's accompanied by pain, redness, or warmth, that could indicate something more serious, like a blood clot and needs immediate medical evaluation. Severe dizziness, fainting, chest pain, or sudden shortness of breath should never be ignored. These aren't meant to scare you. They're meant to empower you with knowledge so you know when to act. I want to pause here and ask you something. Have you experienced any of these symptoms since starting amlodipine or any other blood pressure medication? Have you found ways to manage them that have worked for you? If you feel comfortable, I would love to hear your story in the comments below. There is something incredibly powerful about older adults supporting each other with real-life wisdom. When you share what worked for you, you might be helping someone who feels completely alone right now. This community is stronger when we learn from each other. I also want to hear what other medications confuse you or worry you. Is it a statin, a blood thinner, something for diabetes? Let me know in the comments and I'll consider making future videos addressing those exact concerns. My goal is to be useful to you in the ways that matter most in your daily life. As we come toward the end of our time together today, I want to leave you with this thought. Your body has been incredibly faithful to you for many decades. It's carried you through life's greatest joys and toughest challenges. Taking care of your heart now isn't about fighting your body. It's about continuing that partnership with new wisdom and new tools. Amlodipine, when it's the right medication for you, is a gift that helps your heart work more efficiently. The side effects we've talked about today are simply data points. They tell us how your unique system is responding, and because you now understand what those signals mean, you can respond with clarity instead of fear. You are not just a patient, you are the expert on your own experience. Your doctor needs your observations, your family needs your health, and you deserve to feel good while you're protecting your future. If this video helped ease some of your anxiety or gave you language to use with your doctor, please share it with someone you care about. Maybe a sibling, a friend from church, or a neighbor who mentioned their blood pressure concerns. Knowledge truly does multiply when we share it. Thank you for spending this time with me. It's an honor to walk this path with you. Remember to be gentle with yourself as you navigate these changes. Listen to your body. Speak up for what you need. And never forget that you are the most important person on your healthcare team. Stay curious, stay proactive, and above all, stay hopeful. Your best chapters may still be ahead of you. I'll see you in the next video, my friends. Take care and be well.